Breastfeeding is a skill which needs to be practiced by both mom and baby in the early days. Look upon your new task as a new job for both of you, and give yourself time to gain confidence and master the skill of breastfeeding together. The single most important aspect of successful breastfeeding is getting your baby properly latched onto your breast for comfortable and effective suckling. Some initial skin-to-skin contact with your baby following the birth will help your baby learn very quickly just what to do. A good way of getting baby interested in feeding is to express a few drops of colostrum and then try to latch him. The sniff latching position. Take a look at yourself in the mirror drinking a glass of water. Chances are you will face forwards and tilt your head slightly back. In order to swallow comfortably, we need to extend our head slightly, the same position we would use if sniffing the air. It's the same for baby. If baby's shoulders and neck are supported with his body facing and close to mother, wrapped around her, his chest is pushed quickly forwards at latch on, the pressure on the back is between the shoulder blades, not higher. This further extends the head, making sure that the bottom jaw connects well below the nipple. This encourages the tongue to come further forward, enabling a deep, comfortable and effective latch. Baby cannot do this if his head is restrained and not free to move backwards. There should be no gap between the mother and the baby's chest, and baby's chin indents the breast. The mother should have no fingers above baby's ears. Baby's nose will be free. For babies, breastfeeding is instinctive. Babies instinctively search for the breast by throwing their heads back and thrusting their chin and mouth forward. Babies need to be brought to the breast in the same instinctive position, where the mouth opens wide, the tongue drops down, and baby is ready to take a good mouthful of breast. Focus on the breast below the nipple going into the baby's mouth. The nipple is attached, so it will follow. The more breast baby has on his tongue, the more effectively he can remove the milk. All babies have receding chins, which means baby must have his head tilted back to place his chin and lower jaw under the breast. If baby's head is tilted forward, his nose would be at the breast first, and baby would struggle to drink well. The instinctive position allows baby to swallow comfortably. In the instinctive position, baby can open his mouth wide and his tongue will naturally fall forward over his bottom lip. Now quietly talk to your baby and encourage him to suckle. Baby loves your voice, and research has shown that young babies will suckle more effectively when they hear their mother's voices. Babies initially do a good few shallow sucks to initiate the letdown reflex, which starts making the milk available for the baby. If effectively positioned and latched, they quickly change over to a good rhythmic suck-swallow pattern, and you will be able to see and hear your baby swallowing your milk. He will now be using a circular movement of his jaw muscle and his tongue, which is cupped underneath your areola to effectively remove milk from your breast. His cheeks should appear nicely rounded, and apart from swallowing, you should not be hearing any other sounds from his mouth. Remember that it is normal for baby to pause at times during feeding. As a general rule, always allow your baby to finish drinking on the first breast and come off this breast on his own before offering the second breast. If, however, you need to take your baby off your breast for any reason, gently ease your small finger into the corner of his mouth, very gently breaking the suction, and slowly and carefully remove your nipple so as not to cause yourself any nipple pain. Breastfeeding should never be painful, and your nipple should not come out of baby's mouth looking flattened or misshapen in any way. Should this be the case, you will need to get skilled assistance as quickly as possible. Once you and your baby have mastered the art of breastfeeding happily and effectively together, All this attention to detail will in all likelihood no longer be necessary. You will then be ready to try out the many other possible variations of positioning, such as the Madonna or side-lying positions. Mums often find these positions more relaxing, and soon you will find that you can feed your baby anywhere with ease, while you in fact are having a lovely rest yourself. As effective positioning and latching are absolutely central to a successful breastfeeding relationship with your baby, we always encourage mothers to seek help very early if they require further assistance. Research has shown very clearly that many mothers really do need ongoing support with breastfeeding, especially new mothers, in order to breastfeed comfortably. Basic concepts for an easier latch. Start with a calm baby, emphasis on calm. A crying baby might have a large rooting mouth, but the tongue will be pulled back. So ensure baby is calm. The mouth will be open and the tongue down. There are 3 steps to remember. Open. The mouth needs to be wide open with tongue down. Angle. The nose is to the nipple, head slightly tilted back, chin first, shoulders and hips pulled in close, whole body facing mom. Oomph. This is to push on baby's shoulders at latch on. What to avoid at latch? Avoid having your hand on the back of baby's head. Avoid allowing baby's feet to push against hard surfaces. Avoid leaving open spaces between mother and baby. Useful for latching newborns, or if there is a problem with latching in order to get a more comfortable position. Baby is supported between the shoulders. An easy way to achieve this is to place the web between the thumb and forefinger in the nape of the baby's neck. Hold baby's lower shoulder. The heel of the hand is between the baby's shoulder blades. Baby is resting on the forearm. Baby is then wrapped around the mom. The buttocks are pulled in with mom's arm. Baby is wrapped only until the nose is opposite the nipple. The wrist is straightened. The pressure on the baby is the heel of the hand. It is important that no fingers go above baby's ears. The head needs to be free to move back. Once baby is latched, mom can adjust her position if she wants to. The baby's ear, shoulder, and hip will be in a straight line. The chin will be pushed into the breast. There will be no gap between the baby's chest and the mother. There will be no need to free the baby's nose from the breast. Make sure baby's buttocks are pulled in close. This will keep baby's nose free. If correctly positioned, there will be no need to hold the breast tissue away from the nose. Football hold. Mom sits upright with a supported straight back. The arm going to hold the baby needs to be supported on the arm of a chair or a pillow. Mom remains facing forward. Baby is positioned with his whole body facing mom. His hips are flexed so that his bottom is touching the back of the chair or whatever she is leaning against. Baby is supported in the same fashion, that is, behind the shoulder blades, head deflexed, nipple opposite nose, no gaps between mom and baby.